Good afternoon, folks. This afternoon's topic is about um, coping with emotional challenges during ongoing cancer treatment. Okay, and it's also about mental health when going through cancer treatment, also. So, with those two things in mind, let's get the show going, shall we? Okay, here. Core meaning of the text based on the page you're viewing. The article explains that coping with emotional emotional challenges during ongoing cancer treatment is less about staying strong and more about learning to live alongside uncertainty, grief, and consistent change. It uses the story of Megan Ray Hirschman, a woman living with stage 4 metastatic breast cancer, to illustrate how treatment affects identity, daily life, and mental health, and then brings in expert guidance on what actually helps people stay emotionally well. What the surrounding page emphasizes: living with cancer means living with perpetual uncertainty. The article highlights that people with metastatic cancer often face ongoing scans and test results that can shift their emotional state day to day. A sense of ambiguous loss, grieving the life they expected while still actively living. anxiety about Anxiety about the future, treatment response, and physical changes. The study cited on the page notes that more than half of women with metastatic breast cancer experience depression and 60% experience anxiety, underscoring how common these emotional challenges are. To normal life doesn't return, people build a new one. Hirschman describes trying to parent, work, and enjoy life while also managing an incurable illness. The page frames this as a universal experience for people in ongoing treatment. You may look fine on the outside while internally navigating fear, grief, and consistent vigilance. Emotional states can swing rapidly. There is a tension between wanting normalcy and needing to adapt to a new reality. What experts on the page recommend for coping? Stay connected with people who get it. Experts emphasize social connection as a protective factor. Peer support, talking with others who have the same diagnosis, because it reduces isolation and anxiety. Helping others with similar diagnoses, which can restore a sense of purpose. This aligns with research showing that shared experience can buffer emotional distress. B. Anchor B. Anchor life in personal values. The page stresses that aligning daily choices with what matters most: family, creativity, spirituality, rest, advocacy can improve quality of life, reduce emotional overwhelm, help people feel more grounded during treatment. This is less about positive thinking and more about intentional living. Allow grief to be part of the process. The article normalizes grieving, loss plans, grieving the person you were before diagnosis, grieving the uncertainty of the future. This grief is not a sign of giving up. It's a natural response to life-changing illness. The deeper message on the page, or of the page. Coping during ongoing cancer treatment is not about eliminating difficult emotions. It's about building a life that can hold them. The page frames emotional well-being as something supported by community, purpose, honest acknowledgement of grief, value-based living, peer connection. It reassures readers that emotional challenges are expected, common, and manageable with the right supports. Okay, guys, now that is section A of B of A's discussion. Here is section B of today's A discussion coming up. And essential meaning of the text. The page is teaching readers that mental health care is not optional during cancer treatment, it's core. Part of surviving the experience, staying resilient, and improving quality of life. It frames emotional distress as normal, common, and treatable. and then offers practical everyday strategies that people can use to support themselves. How the page describes the emotional impact of cancer. The article emphasizes that cancer treatment brings anxiety, fear, sadness, frustration, uncertainty about outcomes and side effects, disruption of routines, and a sense of life being upended. It cites research showing that up to a third of patients experience depression or anxiety, reinforcing that these reactions are widespread and not personal failing. The message: your emotional response your emotional responses are valid, expected, and deserve care. Why mental health care matters. The page highlights that tending to mental health can reduce anxiety, improve sleep, increase energy, support the immune system. It positions emotional well being as directly connected to physical well being during treatment. Key strategies the page recommends: build a support system. The article stresses the importance of family and friends, support groups, charities, and community organizations. It notes that the Holistic Cancer Center offers groups, including art groups, where people can connect with others who understand their experience. Core idea: connection reduces isolation and helps people feel held through the process. Prioritize self care. Self care is framed as tending to emotional needs, not just pampering. Examples include creative activities, nature, music, rest without guilt. The page encourages people to give themselves permission to slow down. Practice mindfulness and meditation. The article highlights evidence that mindfulness based therapies reduce distress and improve quality of life. It recommends deep breathing, guided meditation, short daily practices. Even 5 minutes is described as meaningful. Four, communicate with your healthcare team. The page reminds readers that oncology teams can offer emotional support, connect patients with counselors, uh, psychologists, or psychiatrists. It encourages people to ask about mental health resources, Stay physically active. Gently, the article suggests walking, yoga, stretching. These activities can boost mood and improve sleep, but it emphasizes checking with doctors first. Be kind to yourself. Self compassion is presented as essential. The page normalizes difficult days, frustration with side effects, changes in appearance. It encourages patience and gentleness with oneself. 7. Seek professional mental health support when needed. If emotions become overwhelming, the article recommends therapy as a safe space to process feelings and build coping skills. The deeper message of the page: you are not meant to go through cancer treatment alone. The article closes by emphasizing community, compassion, and the availability of support services. It reassures readers that it's okay to struggle. Help exists. Mental health care is part of healing. The Holistic Cancer Center offers counseling groups and holistic services to support mind, body, and spirits. Okay, guys, I'll be back on with B shortly. Okay, give me a bit for B, please. And I'll be back on with that for you. For now, Gator Wellness. Take care, folks.